Bering Omega was founded in 1986 by caring volunteers from two churches in Houston to respond to the unique challenges of the very new and frightening disease called AIDS. At that time, people were not being diagnosed until they were in full-blown AIDS. They were very ill, and they generally lived for a relatively short period after diagnosis. Our volunteers responded by establishing a daycare program to allow caregivers to continue to work while we cared for their loved ones during the day, by establishing a dental clinic because the mainstream dental community had shut their doors to people with AIDS, by establishing a residential hospice where people with AIDS could live their final days in comfort and dignity, and by establishing a financial assistance program to help keep AIDS patients from losing their homes. Initially, these services were needed for all AIDS patients because they simply were not available because of the dramatic and short-term prognosis of people with AIDS and because of the tremendous stigma associated with the disease. Over time, treatments have improved. Stigma has decreased to a certain extent, and more services have become available to patients with HIV/AIDS, if they have the financial resources, coupled with the knowledge, as well as the physical, emotional, and social capacity to access them. HIV/AIDS is rapidly becoming a disease of poverty, and to those that lack access to health care and education. For example, more than 40% of new infections in the United States are occurring among African Americans, who represent only 13% of our total population. This is where Bering Omega has evolved over time, along with the pandemic itself. The critical need for oral health care, day treatment, housing assistance, and hospice care among people with HIV/AIDS has not changed, but access has. So we have evolved into the role of a community safety net provider of these essential services to low-income and indigent individuals who have no other means to receive this critical care. Bering Omega remains the only organization in Southeast Texas that exclusively and specifically exists to provide for the oral health care, day treatment, and hospice needs of low-income individuals living with HIV and AIDS. In addition, we play a critical role within the community in addressing the housing needs of more than 450 HIV-affected households each year. Our primary purposes are to prevent suffering, improve health outcomes, prevent homelessness, and assist our clients to achieve self-sufficiency. Each of our 4 core programs not only significantly improves the lives of our clients, but also reduces the tremendous public costs that would result if these needs went unmet. We significantly reduce unnecessary or preventable emergency room visits and hospitalizations through both our oral health and hospice services. Our day treatment program serves clients who are severely physically and/or emotionally challenged, many of whom would otherwise require costly home health care services or even be confined to nursing homes. Our housing assistance program helps hundreds of individuals and families achieve or maintain stable housing, preventing homelessness. And all of our programs, individually and collectively, give our clients the support and services necessary to seek or maintain employment and to ultimately become self-sufficient if they have the physical and emotional health to do so. Each of our programs is near or at capacity, and the need continues to grow, particularly in these challenging economic times of stagnant employment, extremely low wages for many existing jobs, and fewer and more limited benefits being offered through employer-sponsored benefit packages. Bering Omega Community Services truly represents a highly effective model for addressing ongoing community health and social service needs. Our 3-pronged approach utilizes limited government funding that's augmented by significant private contributions and leveraged by the efforts of more than 500 volunteers who collectively contribute more than 25,000 hours of service annually. We collaborate with our city and county health departments, our local hospital district, and area federally qualified health centers to ensure that our collective resources make the greatest impact. Because we address specific needs among a specific population that are not being addressed by any other organization or institution, we have been able to create a wide range of partnerships and collaborations that benefit not only our clients and our organization, but many other organizations across the community. For instance, we collaborate directly with the Harris County Hospital District, which provides the primary care services for by far the largest portion of our clients. They rely on our day treatment program to help the most physically and emotionally disabled of these clients to understand why medication compliance is important and to help them develop the skills and attitudes to allow them to manage their disease effectively. The hospital district is also charged with providing oral health care for indigent adults across all of Harris County, and they rely on us to provide the specialized care needed for people with HIV/AIDS, allowing them to use their extremely limited resources to serve as much of the non-HIV positive population as possible. The same is true in our collaborations with virtually all of the federally qualified health centers across our region. We also work closely with such diverse organizations as the Houston Food Bank, the Houston Volunteer Lawyers Project, and Metro, our local public transportation system, to effectively coordinate their services to our clients and to integrate them into an overall plan designed to help each client achieve optimal health, psychosocial, and independence outcomes. We are uniquely positioned as well, and through our many years of service, we have developed funding relationships with corporations, major foundations, and generous individuals that allow us to serve many more clients more effectively than our government contracts alone would support. The same is true with our huge volunteer corps of individuals who assist in virtually every aspect of our work. Much of the success we enjoy in securing and maintaining these financial and volunteer resources stems from effectiveness, but also comes from our focus on serving a specific need and a specific cause that is important to our constituents. However, as government funding remains stagnant and in many cases has decreased and gone away, it will become more and more important for private donors, corporations, and foundations to step in and provide the critical funding needed to continue and, as necessary, expand these services. This is the responsible thing for us to do as a community, not only because of the human needs, but because it makes tremendous economic sense. Bering Omega is extremely effective because we focus on specific needs for a specific population and collaborate with the broader healthcare and social service community to integrate their services into a coordinated and comprehensive care plan for each of our clients. We've developed tremendous knowledge and core competencies in each of our 4 core program areas because we began addressing these problems at the outset of the HIV/AIDS pandemic and have stayed focused on addressing these needs ever since. For example, the dentists who founded our oral health program developed, verified, and then published the protocols called universal precautions, which are still used today as the basis for infection control in all oral health settings around the world. Since then, our dentists have been the first, or among the first, to see anything and everything that's unique to the oral health of people with compromised immune systems. We have identified these unique problems, figured out what they were, learned the most effective way to treat them, and then published papers and conducted training sessions to teach other dentists what we've learned. Beyond what we do ourselves, we're committed to teaching others how to replicate our services. For instance, we have an ongoing partnership with the University of Texas Dental School, wherein every resident completes a rotation in our dental clinic in order to learn the basics of HIV dentistry, which can also apply to their patient populations with compromised immune systems, such as those undergoing chemotherapy or who have had organ transplants. This rotation also helps to reduce the potential fear and stigma of treating HIV-positive patients when they go into practice. We're also extremely effective because of the magnitude of community and volunteer support we have developed and nurtured over the years. We regularly receive tremendous amounts of in-kind contributions, ranging from food to clothing to medical supplies and equipment, all of which reduce our costs and expand our reach dramatically. We benefit from the support of more than 500 volunteers who annually contribute more than 25,000 hours of service. We have volunteer dentists, assistants, and hygienists who supplement our core staff in our dental clinic. The medical director of our hospice program is a volunteer, as is our chaplain. Volunteers staff our front desks and coordinate client appointments and services. Volunteers work in our day treatment center, preparing and serving meals, as well as providing everything from health education and financial literacy training to art therapy and pet therapy sessions. We have approximately 200 regularly scheduled volunteers who work from 9 a.m. to 9 p.m. 365 days a year, providing care to our hospice residents. These volunteers do everything from feeding, bathing, changing diapers and bed sheets, to simply reading to residents, sitting with them, praying with them, and supporting their loved ones. We work very hard to make sure that our programs and services make measurable and meaningful differences in our clients' lives and have substantial benefit to our community. Clients enroll in our day treatment program through referrals from a physician or a mental health professional that documents their need for assistance in managing their disease and their health. Upon entry, we document their health status through measurement of their viral load, the amount of active virus circulating in their bloodstream, and their CD4 count, the measurement of healthy immune cells. After 90 days of participation, more than 75% of our clients have reduced viral loads and increased CD4 counts, meaning that their health is dramatically improving. We also conduct a preliminary psychological assessment, and again, after 90 days of participation, more than 70% of our clients report reduced levels of depression, feelings of isolation, and tendencies towards self-harm. Economically, we also track our impact by comparing the $80 a day cost of our program versus a similar Medicaid-funded day of home health care or nursing home care of approximately $248. Tracking oral health outcomes is a bit more difficult in that we provide all needed services and provide ongoing care and follow-up to more than 80% of our clients. Getting many of our clients to comply with routine and non-critical care is often challenging because of their other economic and social challenges. But our compliance rate remains high because they trust us and they know we are only here because we serve their specific needs. Economically, our general dentistry services cost an average of $100 compared to $300 in other public health settings. And our prosthodontic services, bridges, crowns, and dentures, average $150 a visit, which is dramatically more cost-effective than in other settings. Our hospice services cost $240 a day compared to a basic public hospital bed that begins at more than $500 per day, and with additional associated costs is often much greater. And there's no comparison to the level of personal and compassionate care we provide to our residents at Omega House. There really is no effective way to measure the direct cost of homelessness, but we do actively monitor our clients beyond the duration of our services and work to ensure that each client, family, and household has a comprehensive and sound plan to achieve and sustain long-term housing stability. As an organization, we continually evaluate our performance against generally accepted nonprofit accountability standards. We undergo extremely rigorous audits from our government funding agencies, as well as our independent auditors. We are accredited by the Better Business Bureau and provide detailed public accountability data through many avenues, including GuideStar and Donor Houston. HIV and AIDS continues to carry tremendous stigma, fear, and misunderstanding. If we are going to make real progress in eliminating this disease, we need to help people look at HIV and AIDS as what it truly is, a major and devastating public health problem rather than a moral issue. The only potential progress in sight at this time is prevention, and it's well documented that individuals receiving appropriate care, both physical and psychosocial, are dramatically less likely to spread the virus. It's critical for people to understand, regardless of their personal feelings, that there are sound and compelling economic and public health reasons to treat HIV/AIDS aggressively and effectively, because beyond the human suffering and tragedy, HIV and AIDS has huge economic impact on every one of us and on our entire economy. It's also important for people to realize that HIV/AIDS is unique in many ways and is really not just another chronic disease. There are over 1,000 variations of the HIV virus identified today, many of which are drug resistant. It's critical for people to understand that even when drug therapy can be effective, it's extremely expensive and often comes with significant and unpleasant side effects and requires ongoing and extensive follow-up in order to be effective. I believe that Bering Omega's greatest accomplishments have been our innovation, leadership, sustainability, and focus. By this, I mean that we were founded in the very early, devastating, and frightening days of the AIDS epidemic by identifying and focusing on very specific needs and services to address completely new problems. We were challenged to figure out how to do things that had never been done before, and initially each of our programs was developed and carried out entirely by volunteers, with financial support only from a very small, affected, and concerned community. Once the HIV virus was identified and it was understood how the virus was transmitted, the mainstream dental community shut its doors to people with AIDS. While fear, stigma, and prejudice certainly played a part, there were simply no protocols at that time to deal with this type of blood-borne pathogen safely in oral health settings. So our initial 4 volunteer dentists immediately set about developing, proving, and ultimately publishing the standards that continue today to be the basis of the universal precautions that are used around the world for infection control in oral health programs. Since those early days, our dentists have been the first, or among the first, to see everything that's unique in oral health for people with compromised immune systems. We've identified these problems, figured out what they were, figured out how to treat them effectively, and then taught the rest of the oral health world how to do so as well. Our staff has published literally hundreds of clinical and scientific papers and has trained doctors and dentists from across the country and around the world. In 1986, hospice was a very new concept in the United States, yet a visionary woman named Eleanor Munger, then a 76-year-old retired teacher, immediately realized there was a huge and unique need for exactly this kind of compassionate care for many of those dying from AIDS in the early days. Many of these individuals had quickly lost all of their financial resources dealing with the huge doctor bills and repeated hospitalizations. Many also had no one able or willing to care for them in their final days, often, again, because of the tremendous fear, stigma, and misunderstandings surrounding the disease. So Mrs. Munger organized a small group of volunteers, raised a very small amount of seed money, and opened Omega House as the first AIDS hospice in the United States and very likely the world. Again, since that day, we've shared our knowledge and expertise with countless others and supported the development of similar programs around the world. Equally as important and impressive has been our ability to adapt and evolve with changes in the epidemic itself, but also among funders, volunteers, and the overall healthcare system in order to remain focused on these specific and unique needs for our specific target population, people with HIV and AIDS who have no other means to access these critical services. As HIV and AIDS care has improved, most services have become readily available for those with financial resources and with insurance. Care for the most vulnerable has been shifted into the public health care system, which generally provides extremely limited services. Most often, and throughout Texas, public care does not include oral health care for indigent adults, nor does it provide for day treatment services or hospice care in most cases. And importantly, any available services for this population cannot compare to the level of expertise, the caring, compassion, and the nurturing environment that Bering Omega offers. This is critical because we truly understand that when people are given the care they need and are treated with dignity and respect, they tend to have significantly better attitudes and health outcomes, and they also tend to take much greater responsibility for themselves and for others. It is challenging in today's environment to retain our HIV/AIDS focus and to continue to concentrate exclusively on those services, our core competencies, that only we continue to offer. Many AIDS service organizations have either ceased to exist or have morphed into the broader public health arena. While this is not always a negative, we continue to believe strongly that the unique challenges and nature of this disease require and deserve specific focus through organizations like ours. We continue to face three major challenges. The first is a degree of complacency. The current perception is that HIV/AIDS is no longer as prevalent, devastating, or costly as it once was. This is simply not true. In fact, prevalence rates appear to be rising again for the first time in more than a decade. And while many patients are living longer and in some ways healthier lives, the disease continues to be extremely difficult to manage efficiently and comes with huge costs and myriad complications. And finally, as HIV/AIDS continues to become a disease of poverty and of those lacking resources, the cost of HIV/AIDS continues to increase dramatically, and these increased costs are borne more and more by our already overburdened tax-supported public health system. Our second major challenge is the trend toward moving more and more HIV and AIDS services into the mainstream low-income and indigent health care system. While this makes sense in many ways, it also tends to limit the scope and amount of services available to this extremely vulnerable population. It inherently limits the specialization that is often critical in dealing with this unique disease, and it ignores the trust and hence the candor with which patients can and do interact with providers they know and trust because of their dedication exclusively to working with HIV and AIDS positive clients. Our third and possibly most significant challenge is the continued pressure to control and reduce public funding for indigent services in general and indigent health care in particular. Each of our core programs results in significant long-term savings for our community. Yet it is extremely difficult in today's environment to gain or maintain support and funding for programs that prevent suffering and reduce much more expensive and critical care service utilization down the road. For instance, providing quality preventive dental care can often prevent the development of major infections or complications that can result in extremely expensive surgeries, hospitalizations, and even death. Day treatment services often provide the support clients need to remain independent, eliminating the need for long-term home health care or even nursing home confinement. Our overriding commitment continues to be focusing on sustainability of our core services and expanding these services to meet the growing demand that is resulting from both the increasing impact upon low-income populations and the ongoing challenges in our economy. Additional resources would allow us to expand our oral health services. Despite serving an average of 70 patients a day in our dental clinic, our waiting lists for services range from 4 weeks to 6 months, depending upon the type and complexity of the service. All of our programs run at near or at capacity, and additional resources would allow us to both expand our reach while reducing our vulnerability to changes in available government funding. And finally, we're also focused on ultimately acquiring our own facilities in order to reduce our ongoing operating expenses and to provide the long-term sustainability regardless of economic fluctuations. Education and prevention are the absolute keys to controlling the spread, cost, and devastation of HIV and AIDS. The challenges of addressing the social implications of a really meaningful public education effort are immense for obvious reasons. It remains extremely difficult to get the public to understand and focus on this disease as simply a major public health problem as opposed to a moral, social, or behavioral issue. It's also very challenging for populations at greatest risk to accept responsibility for aggressive education and prevention efforts because of these stigmas and misperceptions. And unfortunately, so far, efforts in this area are at best fragmented and marginally effective. Ultimately, Bering Omega Community Services is perfectly positioned to play a leading role in creating and executing broad-based and effective education and prevention programming. Our experience, our community-wide collaborations, and the trust we have built over the past 25 years position us to not only build the needed coalitions and leverage the necessary resources, but to engage the current client populations and communities at greatest risk in efforts to help improve the health and quality of life for themselves and their communities.